What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Why are cats such great bakers? They make everything from scratch. What did the stuffing say to the turkey? I'm so into you. I decided to sell my vacuum cleaner. It was just gathering dust.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider. Gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And in the studio, Tacey, my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from sabbatical, PA Lydia.
Hello.
This is a show for people who have never listened to a medical show on the radio or the internet. If you got a question, you're embarrassed to talk to your regular medical provider. Oh, my God. If you're embarrassed to take to your regular medical provider, or if you just can't find an answer anywhere else, give us a call at 347-766-4323. That's 347. My brain got ahead of my tongue. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. And most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Please don't forget to check out stuff.drsteve.com, stuff.drsteve.com. Our website's a little weird right now because I've been working on it, but stuff.drsteve.com still works. You can go straight. You didn't get that widget that you wanted for the holidays? Well, go buy it for your damn self. You're an adult. And you can do that at stuff.drsteve.com. Just click straight through. Really helps keep us on the air. And simplyherbals.net. That's simplyherbals.net. That's Dr. Scott's website. Check it out for your CBD, nasal spray needs, and all kinds of other stuff like that. And then Tacey and I are on Patreon. Patreon.com/weirdmedicine. Finally, the Chad Zumach episode is out. It's there. After all of this, talking about how I was going to edit it and chapterize it and try to make it make sense, because it was one person with ADHD talking to another person with ADHD, I just said, screw it, and I just threw it on there as it was. And actually, I think it probably makes more sense to do it that way.
Probably does.
And Dr. Scott was on.
I was on that one. Yeah, that's a good show.
It's the only time he's been on Patreon. But Patreon.com/weirdmedicine. We've had Pete Davidson. We've had the Troika of Opie and Anthony. We're going to, Joe List and Kevin Brennan are coming on. We're going to have some interesting people on over the next few months. So check that out. And then if you want me to say fluid to your mama, or if you want Myrtle to...
you don't want Myrtle.
I put that... 2.5 minutes. P.A. Lydia, were you here that day?
Was.
Okay, yes, you were, because I have video of you laughing.
She was here.
But yeah, this person called and asked, or in Cameo, said, "Can you do that old lady character? Because my wife hates it, and can you do it for a really long time?" And Myrtle can just talk forever. So if you want me to put the wig and the teeth on, that's the same price. It's $9.
The same price, everyone.
That's right.
Low price.
So cameo.com/weirdmedicine. All right, very good. Hey, Dr. Scott, simplyherbals.net, still going. Check him out at simplyherbals.net. That's simplyherbals.net. What's going on there?
Just selling that nasal spray like crazy.
Okay, very good. Very good. And you have a super secret project that you can't talk about yet, is that correct?
It is super secret, and I can't talk about it yet, but we're working on it.
Okay, all right. Stay tuned.
Well, part of the problem is Denver's getting snowed in, and that's where part of the secret project is coming
is
from.
it Denver?
Yes. I'm going to give you 3 guesses.
What else do they sell in Denver?
Yes, I can't imagine what else they sell.
Oh, my God.
It's top secret, Dr. Steve.
All right, very good. That's awesome. Check out drsteve.com, and we'll try to, and simplyherbals.net. We'll try to keep you up to date on that. I completely revamped the website, and I did it by myself, and now it looks like shit. So I'm working on it. Give me a little bit of time where I can actually spend some time on it. And let's see here. Yeah, all right.
Should we explain why we missed a week?
Well, it was New Year's.
Oh.
Yeah, we can talk about it.
it.
I mean, that's why we didn't have a show on.
Yeah, it was going to be a first ever Christmas Eve show.
Christmas Eve.
Yeah.
Oh, yes. Okay, I know.
Yes.
Okay, so
we were all excited, and
Yeah,
somebody decided to get, the puke bug or something.
yeah. So first, Liam's girlfriend had it, and then we thought we were out of the woods, and then Liam got it. So the incubation time on this virus was about 3 or 4 days. Mm-hmm. That was what screwed it up. And then Tacey got it. And then Christmas Eve, we were going to start, and Beck and I said, if we don't get it by Christmas Eve, we're in the clear. And Christmas Eve, 4 a.m, Beck started barfing.
Ooh.
And what a good kid too! Didn't even wake me up. I just, I heard him up at like 7:30 in the morning because I was getting ready to do some stuff, cooking and all that kind of crap. I said, "What are you doing up?" He said, "Well, I've been throwing up since 4." It was like, "Damn, dude, why didn't you?" I mean, in the past, if they threw up or if they had a bad dream, they would wake us up, and he just, soldiered through on his own. Didn't want any medicine. Finally took some Phenergan that made him sleep all day, and he, anyway. So we didn't want anybody else, because then the clock starts ticking for me again, because I was out of the woods at that point from Tacey's episode. But today was the last day. No, gosh, that's not right. Wednesday or Thursday. Oops. Well, I've been sleeping on the couch for
gonna
nothing.
have it.
No, sleeping on the couch for nothing. No, my last day was Wednesday, so there's none of that virus in the house now that we know of, unless we got it in the wild. So, yeah, we were going to have a Christmas Eve show, and we had Christmas music that Scott and I were going to ruin.
Yes, we're going to butcher it.
Damn it!
I know.
Oh well.
I practiced for 15 minutes before I came on.
Did you?
A whole 15
I practiced like I normally did. So I was just waiting for you to bring the sheet music and then learn it on the air.
Uh-huh.
Okay. Well, anyway, so yes, thank you, Tacey. I had sort of forgotten about that.
Yeah.
Anywho, put it out of my mind on purpose.
How long did it last? Your
8 hours max.
Good.
Max.
Oh, that's
And then you
good.
feel crappy.
Oh, heck yeah.
That's not long enough to lose weight or anything. Right?
No.
I lost about a pound.
Yeah.
But then the next day, you're like,
Yeah, I can
Wiped
eat.
out, kind of.
yeah, it's totally wiped out.
Yeah, but then after that, you're like, I can eat anything I want to, and then you know.
I've got a pound to spare.
Gotta make up for it.
That's right.
All right. Well, do you guys have any topics, Lydia? Did you bring anything today? No.
I mean, I've always there is something called Instagram,
Yes.
right? And they have these
I've heard
things
of this
called
thing.
Reels,
Okay.
which I've newly discovered.
I don't know what those are.
They are
'cause
these
I'm
little
old.
short videos.
Oh, it's their
similar to
version
being
of
on
TikTok.
Yeah. And you can see all of these gross and disgusting procedures.
Oh.
And for some reason, they think that I like it, which I kind of do.
Yeah.
So it was something I've never encountered in medicine, and maybe you have, Dr. Steve. The concept of ingrown hairs we know about.
Yes.
Right?
Right.
But the concept of these ingrowing hairs that grow for years under the skin.
Well,
And they get up to like 10 to 20 inches long.
oh, wow.
And then people pull them out.
Huh.
You know,
I've
no
not ever heard
infection.
of such a thing except in a pilonidal cyst.
Yeah. These are just places on.
That sounds.
I looked it up. I mean, there's an up-to-date section.
Okay, you looked
right,
it up.
on pseudofolliculitis, but you know that's usually we think of it as being a problem when it's associated with infection.
Right.
Anyway, my question is I've never seen it in someone.
I have never either, except in a pilonidal cyst. So let's
Yeah.
talk about those for a second.
Yeah.
Because when I was in medical school, I remember scrubbing into surgery, and they would pimp you constantly, just ask you question, and half the time you didn't know what the hell. And this time I was totally prepared because I realized they were taking all the questions out of the front of the book where they talked about the history of the surgeries that we were doing. So I knew I was scrubbing in to a cholecystectomy, and I knew that son of a bitch was going to say
the little blue
Yes.
the little blue book.
yeah, and I knew they were going to say, when was this surgery first performed, and I could say it, because I was ready for him, and when I answered it correctly, he was like, oh, okay, here we go. So he kept asking more and more questions, and then he got to one I didn't know the answer to. I said, well, I don't know that, but I know this other thing, and so I answered. He said, good technique. Always answer the question that you know the answer to. So rather than the one that I asked you. So I'm going to answer the question that I know the answer to, which is about pilonidal cysts, because I don't know about these damn ingrown things, that are 20 inches long. But pilo being hair, nidus being nest, so it's a nest of hairs. And it's basically ingrown hairs above your ass crack.
Yeah.
And those things can get really long. And when it comes from sitting, it's slouching, basically, if you're sitting reclining and you're sitting on your sacrum instead of on your ischial tuberosities. So if you feel down, if you guys are sitting, and people who are listening right now, sit up straight, put your hand under your ass, and you will feel a bone right about equal to where your anus is, but over to the side on either side. There's a bone there, and that's what you're sitting on. Do you feel that? Those are the ischial tuberosities. That's what you're supposed to sit on.
sit bones.
But if you feel the above your ass crack to that flat place, you can slouch backward, and you can sit on that. That's your coccyx and your sacrum. And if you sit on that, then what you can do is you can compress the hair follicles and and you end up pushing them under the skin, and the hair will continue to grow, but it grows under the skin. Yes.
Way more often in men than women, because I don't have ass crack hairs like that.
Yeah, I think so. That's a great question, Tace. Let's see.
And a lot more in athletes wearing jock straps, football players, catchers.
Really?
Yeah.
No,
I can see
that makes
The
sense.
sweating, and those jock straps kind of rubbing and kind of forcing those hairs back in.
Interesting.
Yeah.
Tacey, guess what?
Give yourself a bill.
Damn it.
Pilonidal disease occurs predominantly in males at a ratio of 3 or 4 to 1.
Dang it.
Predominantly in OFE, typically in the late teens to early 20s, decreases after age 25 and rarely occurs after age 45. So I can slouch all I want to.
There you go.
Hell with you all.
There you go.
So anyway, yeah, very interesting. And those things will fill up with hairs that are really long. And the problem with the pilonidal cyst is you can, if it gets infected, you can stick a needle in it and it will always come back. So they just have to be surgically repaired.
Can get quite deep.
Yep.
We don't go digging around in them in the office.
No.
Take
No.
it to
I mean, you can
surgery,
stick
so.
you can stick your finger right in there. It's disgusting. Anyway,
Gross.
all right. Very interesting.
Yeah.
Thank you, PA Lydia.
I actually saw a patient this week, and they have other problems like cancer that we're dealing with. But he said, "Yeah, my cyst is starting to leak," and I'm like,
Oh.
"Buddy, we got bigger fish."
Yeah. I see that all the time too. Or people with stage 4 cancer that are,
Having to sit a lot, and
or just worried about things that are tangential to what's going on, because that's easier to focus on, I think.
Probably.
It's overwhelming.
So talk a little bit about
yeah.
those ingrown hairs. Like when they pull them out, what happens?
Oh man! So it's like they, what is it called when you dehead? You take the plane off of something.
Yeah.
I can't remember. Anyway, you take the initial layer of skin off and just open it up because it looks like a deep blackhead, and they start pulling it out, and it's just this hair that just comes out. It's
Something even more disgusting is look up bot fly infestation, where the bot flies will deposit their larvae under the skin, and you see people. Now I can't think of the word either, where you decap it.
Oh, man. Yeah.
Anyway, you take off the top layer, and then you take tweezers, and you just start pulling these giant maggots out from your skin.
Oh, for
It's
God's
so
sakes.
satisfying.
Where does that happen? Here?
Not around here. Where are bot flies? I don't know where bot flies are. They're not here, though. Where are... we'll ask Echo. Echo, where are bot flies found?
According to an Alexa Answers contributor, bot flies are found in Mexico, Central, and South America. In the U.S., cases usually occur in travelers who have visited endemic areas. Flies live near water, thus coastal and forested or jungle areas
Echo,
are endemic.
you. Thank you very much. Good Lord.
My pleasure. Just doing my job.
Echo.
Oh, there
geez,
you go.
shut
Thank
up.
you. She's such a good sidekick.
So anyway.
I'm sorry, I was trying to show Tacey a video, and the
Of the
sound
bot
keeps
flies?
going on.
What's it? Just turn your
I
sound
thought the sound. I thought you were playing some kind of old spaghetti western.
Yeah. All right. You guys ready to do some questions?
Yes.
Okay.
Do it.
All right. Let's do it.
Number one thing, don't take advice from some asshole on the radio.
All right. Well, we have a quiz from Stacy.
Oh.
And this is a good one.
Right.
I think this is a good one. We'll go around the room. We'll see.
Uh-oh.
Okay. And this is Price is Right
No
rules.
Googling.
Yeah, no Googling.
What percentage of the 206 bones that's in the human body, what percentage are in your feet?
So what percentage of the bones of the human body are in the feet? And we'll give you that there are 206 bones in the human body. All right, Dr. Scott?
10%.
Tacey?
12%.
Damn it. Lydia?
1%, Bill. I'm just kidding. Actually, the 10% sounds good. I'm going to go with Tacey, what did you say?
12.
12. Yeah, I'm sorry, we're having to split hairs here.
It's Price
We're
is
going
Right
with
rules.
11.5.
Oh, that's a terrible answer.
Yeah, that's
She's
a-
going to get a negative bail.
It's not a terrible
Is
answer.
it? Yeah, that's a negative answer.
Strategically.
There's only one answer, Dr. Steve. There's only one answer.
Yeah.
13.
Right. That's the if you don't know the answer, that would have he's right.
Yeah.
It's strategically from
13.
game playing, because remember, Price is Right rule. It does. I'm not explaining Price is Right rules on the show. Okay, but the answer is going to astound you.
Is it more?
Yeah, that's 25% of the bones
In
of the
the
body.
feet?
Yes. So here's the deal. There's 26 bones in every foot, and there's 2
Okay.
feet. So if we ask Echo, what percentage is 52 of 206?
52 is 25.24%
Isn't that
of
crazy?
206.
Damn. Fantastic. Tacey, you win.
I win.
You gave her a bail.
Yay.
That's 2 for her. No, we're 2 behind.
I know. Tell
Yay,
you what.
Tacey.
That's just what I get for trying to do math in my head. All the metatarsals
the worst. That's the
and
worst.
tarsals,
Yeah.
phalanges.
Yeah, I know.
You
Now-
could not have pigeonholed that answer anymore.
I know. Yeah, you'd had to exactly be 11.5
That's
for
the
her to
only
win.
answer. Oh my God! All right,
It's okay. We can play poker with PA Lydia.
Yeah, we could. Yeah, did you bring cash, Lydia? We might have
Or-
Not a
later.
debit card.
We got that works.
She may be marking herself as a mark, though,
She's
so
setting
that
us
she
up. I
would
think
set
she's
us up.
sandbagging.
Yeah.
I believe she's sandbagging.
All right. Here's another one, and this is just
Can you breathe and swallow at the same time? Casey!
So that's a yes or a no question, so we won't really do that as a quiz. Anybody have any discussion on that?
What about when you choke?
Well, yeah. So
Is that breathing and swallowing at the same time?
I guess the question is, can you functionally breathe and swallow at the same
I
time?
think, yeah, and what is breathing?
I will say
Right?
no.
Is it
Ooh,
what is breathing?
How do you define the word is?
Yeah. You know, is it the exchange of oxygen?
Yeah,
and,
so breathing is breathing.
Yeah. Well, your epiglottis should close.
Correct.
So you shouldn't be able to take anything into your esophagus at
But
the
that's
same
the
time
whole
you take
point
a
of
breath.
that. That's
right.
Yeah, breathing ceases during swallowing, and the pause in breathing is due to inhibition of respiration at the neural control centers of the brainstem, not just due to closure of the airway. So it's an evolutionary advantage to, our ancestors, the ones that didn't breathe when they swallowed and the ones that did and were choking all the time and had aspiration pneumonia and stuff and didn't live long enough to transfer their genetics to the next generation.
Those neural control centers must be close to how we have patients swallow in order to hopefully get them back into sinus rhythm sometimes.
Yes.
You think?
Yeah.
Very close.
Yeah, and that's some of that. Okay, you bring up a cool thing, this thing called the diving reflex. So when whales and other sea-going mammals dive deep, how is it that they can take a deep breath and stay down there forever? Their lungs proportionally aren't that much bigger than ours, but they can stay down there for hours. And part of it is that when they dive, their metabolic systems start to slow down, and their heart beats slower. Their vagus nerve gets stimulated, which slows down, the blood flow from the heart to the rest of the body, and they're allowed to stay down longer. We have that too. All mammals have it. Even land-going mammals have it. This is the craziest thing. Mm-hmm. And when I was I was an intern back before we had drugs like amiodarone and stuff. We would have to shock people if they went into crazy rhythms a lot of times. And one time I had this guy, he was totally stable. I said, "You want to try something?" And he said, "Sure." And I said, "Let's do a diving reflex." And I can't even imagine doing this today. But we got a bucket of ice water and, something like one of those plastic basins that they wash people with. And we filled it up with water and ice. And then we took the guy's head and we just smashed it in there. It said, "Hold your breath," and put his face in the ice water as long as he could stand it. And when he came back up, he was like, "That was very unpleasant." And then, boom, his heart went back into normal rhythm. Mm-hmm. That's cool.
Yeah.
So the old diving reflex. Mm-hmm. So, so all of those things it's amazing. So why do we have that? Mm-hmm. It made our common ancestor able to live in the water, but did they give us the gene, or did we just have it? And somehow mammals just had that, and so they were, they could adapt to living in the water. I don't know. That's crazy.
Yeah, you just kind of. Yeah.
I guess it's like
stimulating the vagus nerve.
We had the
cold water
common.
to
When did we diverge from reptiles? Right, we went through from reptiles.
Well, it was
to
before.
birds,
Yeah, it was
birds.
before the big disaster, but we were shrews back then. I mean, mammals were, when the dinosaurs died, the biggest mammal was about the size of a shrew. So, but there were mammal-like reptilian ancestors that they found. So, you never find that one that's half and half. It's not how evolution works. But anyway, I don't know. It was a long time ago.
Yeah.
Long as time.
If you believe in evolution.
Well,
just kidding.
Yeah.
I'm joking.
No, you're right. If you do.
Yeah, if you do. Yeah.
If you don't, you believe whatever you want to. It's all faith.
We don't judge here.
I put dinosaurs at the nativity scene this Christmas.
Oh, did you?
My daughter woke up to Christmas and we had a little nativity scene, and there were the wise men and the dinosaurs.
Oh yeah. Well, see, because
her.
Noah didn't have room on the ark for the dinosaurs.
Clearly.
And then the other thing is that, what I've heard the creation scientists say is that the reason that you see more advanced animals higher up in the strata, if you go in and you find a place where there's lots of layers over the eons and you dig down, you'll see simpler and simpler animals the farther down you go. And what they'll say is during the flood, the more advanced animals went to higher ground, and that's why you see that, okay, is that you'll see more advanced animals higher up in the strata. And then, but the question that raises is that you see clams everywhere from millions of years ago to now. So if their answer is right, then it implies that some clams were smarter than others and they got to higher ground during the flood. I don't know.
Or just luckier, they got washed up to higher.
Oh, that might be. That's it, Dr. Scott. Anyway.
Yeah.
All right, here we go.
Well, hey, guys, thanks for the call. This is the Rowan County Redneck, and I wanted to know how do all the nerves in your rectal vault determine whether it's wait, let me get this alphabetical, a fart, a shit, or a shark? Thank you very much.
Yeah, so how do you know?
That could be the question of the day.
When you expel something, when you're getting ready to expel something from your rectum, how do you know it's a fart, a shit, or a shark?
A shart is obviously a mistake.
Yeah, so I'm going to argue, let's take that out of there
that one out
because
of the
you
equation.
don't know
Yeah.
that it was a shart because the whole
Until it's
reason
too
it's
late.
a shart was you messed up.
Yeah, until it's too
So
late.
obviously the system isn't perfect. But here, Tacey, you have some wine
and experience.
And Scott, do you have? No, I didn't mean that.
Oh.
Everybody has a drink. Okay, so everybody take a drink real quick. Okay, we're going to take a drink. All right. Now, hold that in your mouth. Now, is it a fart, a shit, or a shart? I mean, is there water in your mouth, fluid in your mouth, or is it air? It's fluid, right? Okay, so let's think about how it's the same thing. You know if there's air in your mouth. If you blow up your mouth with air, that's air.
Yeah.
And when there's liquid in there. So there are sensors that one of the things that liquid does, let's talk about it, is it exchanges heat more efficiently than air does.
Right.
So if you have hot water in your mouth, you can feel that as that there's something that is touching all the areas of the buccal mucosa and it's transmitting heat either into the buccal mucosa or drawing it away from the buccal mucosa if the water's colder than your. If you get water that is exactly the temperature of your body and you sit there long enough, it'll extinguish that feeling. You might not be able to tell. So, I mean, how do I know that I'm holding a phone in my hand? Sometimes when I'm sleeping, I think I still have my watch on my hand. So it isn't a perfect system, but it's pretty good. And from a evolutionary standpoint, it's very good because you don't want to be dropping loads around in your, if you couldn't tell, you'd just be dumping loads where you're sleeping. That would be a mistake, but it's okay to pass gas, right? Because for sanitation reasons, but also you don't want saber-toothed tigers able to track you to where you sleep.
Right on.
But the rectum has same sorts of nerves. They're just not as perfect. Now, you can't taste stuff, thank God, that's in your rectum. That would be horrendous if you're constantly tasting shit, in your rectum. But there is a person, and his name is Richard Christie. He worked for Howard Stern. He swore that if you poured different beers into his ass, he could tell the difference, and he could sort of taste them. Now, those have alcohol in them, and the alcohol may actually be absorbed and then draw in some aromatics with it. So I think he might be right on that. It'd be an interesting test to do. I'm not going to volunteer,
nor should we advocate for
alcohol in the
No. I would only do it for the science, not. I don't add. We've talked about on this show multiple times.
Oh yeah.
Don't
do that.
Drink alcohol by shoving it up your ass.
Or on a tampon as a woman. That was popular when I was in college.
Well, we
what?
Yeah, but did we debunk that?
She's where you know that you were maybe you weren't here. We did a vodka tampon challenge on the show. If you go back,
that poor girl
in the
God
archives,
Almighty.
Because we said no, you can't get drunk that way. The vagina is not designed to absorb things.
Okay,
if you took that tampon and shoved it up your ass, maybe. But even then, we also measured how much you could absorb into a tampon. It was less than an ounce.
Oh,
what about something like cocaine?
Yeah, maybe.
Possible.
Maybe, but let's not give people ideas. But we took a tampon, saturated it in vodka. She shoved it up her vagina, and then we did a breathalyzer test every 20 minutes during the show, and there was nothing. It never raised. And then she had an itchy vag for like a month.
I bet.
Yeah.
Man.
Yeah, stupid. And then we showed frat guys, fraternity brothers, sorry, Tacey, putting thimblefuls of alcohol under their eyelids. It's like, why are you doing that? First
Just
off,
drink it.
You can't, you can't get but a thimbleful.
Yeah.
It's going to irritate your
and the
conjunctiva.
eye can take a third of a drop.
Right.
Right.
And then the rest of it
runs out.
It's idiotic. Just drink it.
Yeah.
If you're going to drink it, if you're going to drink. And then we talked about the guy that died giving himself champagne enemas. He did 2 bottles of champagne and then was watching doing autoerotic asphyxiation. And he died from alcohol poisoning, not from the autoerotic asphyxiation. That wasn't the problem. He was breathing, or he had been breathing till he died. So don't do that. Another guy did a concrete enema. That was stupid.
Yeah.
Don't do that.
Nope. Concrete, by the way, is an exothermic reaction, meaning it gives off heat.
Really hot.
Warm.
And that guy cooked himself from the inside. Died.
Yeah.
Yeah, I know all this stuff was from this journal called the National Association of Medical Examiners. I was a medical examiner when I lived in Vermont, and I joined, and it was their journal, and it was page after page after page of the most fucked up deaths you've ever seen. Yeah.
Wow.
So anyway, they love it, those guys. So anyway, all right.
Yeah, the pathology department is.
Yeah, they're
One place in
different.
itself,
They're different.
yeah.
We love them, but they're
Yes,
different.
we do.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly. which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Sergeant and Mr. Smith, you're going to love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
All right, now this person... Oh, Tacey, you need to listen to this one.
Okay.
Hey, Dr. Steve, this is Haas. I just wanted to let you guys know that I work for an oxygen company.
Okay.
And we had to send in all our ventilators to Philips for a recall. And Philips thinks that it's caused by ozone cleaners.
Oh.
But it also affects BiPAPs and CPAPs. And I just thought you guys would want to know. Thanks, bye.
Oh, and I've still been using my...
Yeah.
Oh, no.
I quit using mine. I'm not saying you shouldn't use them. I don't know what the data is. If you go on those forums, and what we're talking about is like the ozone cleaner for CPAP machines,
Okay.
and they don't actually clean anything; they'll sterilize it.
Okay.
And you would think that would be a good thing, but if you go on the forums, they're all just anti this and that. But I can't find any data that shows it's harmful at all. Although I've been using ultraviolet cleaner for my retainer, for my Invisaligns, and the damn retainer cracked, and I think the ultraviolet has made the plastic brittle.
Wow!
They told me use the bright, retainer cleaner, and it's just a pain. You have to put the little tablet in. It's like Polydent or not Poly. What's the one?
Polydent.
Polydent, the one that cleans your dentures.
We know what you're talking about.
I just felt like an old man.
It's Polydent.
Even more than I already do. So I got this ultraviolet thing thinking, whoa, this is, I'm young and
Is it
hip.
short wave or long wave?
I don't know.
Say?
That's a
Well,
good
there goes
question.
another $7,000,
Yeah,
Steve.
I know. All right. So anyway, check check your manufacturer's recommendations and check with your provider whether your ozone cleaner is okay for you.
I wish we had the answer to that question.
I know. Well, there's people doing research on it. I know that.
For myself and for everybody else.
Yep. All right. Well, let's look that up, see if there's anything more definitive out there for next week. All right. This is a weird one.
Hey, Dr. Steve. My name is Elliot. I
Hey,
was
Elliot.
just recently offered a job in a New York City hospital. And long story short, back in November of 2020, I was a participant in the AstraZeneca trials.
Okay.
And I took both shots. Subsequently now offered a job in hospitals over here in New York, and they're not recognizing the AstraZeneca as a vaccine shot. And they want me to take 2 more shots. Is that something that is safe to do? Thank you.
Wow.
That's a tough one.
I'm looking here that says, now this is from nycgo.com. For travelers to New York City, vaccines listed for emergency use by the World Health Organization, such as AstraZeneca vaccine, as well as FDA or WHO approved mixed doses qualify. So isn't that interesting?
Yeah.
I wonder what that's about. I could not find anything on this. The WHO recommends all countries accept all COVID-19 vaccines, including the 2 made in China, AstraZeneca, one of the ones in the UK, and then Pfizer. So,
Was the AstraZeneca an mRNA vaccine as well, or?
AstraZeneca was a weird vaccine. It used a viral sort of Trojan horse.
Okay.
And so it was different, but it was shown to be not as effective, but it was still effective. So I don't know. We'll have to do some more research on that. Will you leave me a note, Dr. Scott,
Sure.
and we'll see what we can find out for him. In the meantime, I would question it and send us the policy. We'll look and see. Number one is, can they do that? Well, employers can either mandate or not mandate vaccines, however they want. Apparently, I was looking at, particularly in New York, I was looking for some OSHA regulations on this as well, and so I'm just going to say I don't know what the hell I'm talking about right now. So, here we go. Medical workers ask Supreme Court to block New York vaccine mandate lacking. I don't know. So, we will do more research on this one and get back to you. Okay, so next week we'll have a special episode on AstraZeneca. All right.
Hi, Dr. Steve. What's up, guys?
Hey, man.
All right, what's up, buddy? How y'all doing?
Good. How are you?
All right. Good job. So what had happened was Santa left a woman that wasn't clean, apparently.
What?
So we were forgetting.
What?
Santa left
Jostle about and kind of hurt my D a little bit. You know how it is. But
I don't.
No.
Afterwards, it continued to hurt.
Okay.
Like for a day or two.
Okay.
Nothing, too out of the ordinary. Just a little soreness, a little tenderness. Now, there was a bit of a discharge.
Oh no!
From the meatus.
The meatus.
And I'm a little. I mean, with the doctor tomorrow.
Okay.
But no buts. I just want to let you know I'm having sex. Yeah! Woo! No.
Congratulations, bro. So he's having sex?
Dirty
and-
sex.
It sounded like he said Santa left a woman that wasn't clean.
That's what he said.
Okay.
Yes, I think over Christmas he had intercourse.
Sounded
and,
then I thought he might have had penile trauma, but no.
That's what I thought
That was
too.
a lot.
Yeah, but if you fracture your penis, which is a possibility, that the pain doesn't go away in a couple of days, and that ends up being a medical or a urologic emergency. But then he had yellowish discharge, so that's more likely to be trick or gonorrhea at that point. So get that taken care of. That one's treatable, easy to treat most of the time. There are some resistant strains to gonorrhea now, but we have treatments for this. So
And
congratulations on having intercourse.
That's great.
What's that like?
I wouldn't know.
Shut up.
Hey, Dr. Steve, to answer your question about flavors being lost during COVID a couple of shows ago.
Yeah.
I, in fact, did experience that in May of 22, and I lost everything except sweet.
Well, except what?
Now, it came back maybe about 6 months after, so that's long ago.
Okay. So he had loss of something.
Everything but sweet.
Oh, sweet. Everything
That's
but
what I
sweet.
thought he said, too.
Okay. Yeah, and that was back in May. So we were talking about just, we're not seeing this now. Back in when this thing first started up, that's how people knew they had COVID, was they lost their sense of smell. Or not everybody, but a lot of people did. And now people just have colds or they don't have anything and they test positive for COVID, don't even know it.
I did go to dinner with someone 2 days ago, and she recently recovered from COVID. It was right after Thanksgiving. She lost her taste and her smell.
Huh.
Strange, right? Healthcare worker had COVID before.
Wow.
So.
Wow. Well, most of the cases we're seeing now are serendipitous. They come in for an elective procedure, and then they test them before they do it, and they're testing positive. They had no idea.
Yeah. Thank goodness.
Yeah, agreed. All right. So, and that's the thing. And then everybody freaks out. And I'm going to say this again. I've said it before on this show. There's 5 other endemic coronaviruses. We don't test for those. Now the 6th one was novel and it caused no end of chaos, but now it's becoming endemic. It's just out there, obviously, because like I said, we're just finding it serendipitously now. Still rough for some people, no question about that. But, the other 5 coronaviruses aren't innocent either. They cause death and mayhem too. It's just that back in the day before 2020, we didn't test for them. We just said atypical pneumonia, viral pneumonia, and people died from atypical or AKA viral pneumonia, and we never knew what it was. Now we can test for this one, but those other 5, if we tested everybody that had a cold, about 40 to 60% of them will have coronavirus of some sort.
Right.
But we test for this one, and now it's special. And, people have to not go to work for 7 days, and they have to isolate, and they have to do all this stuff. So at some point, we're either going to have to test for all these viruses, or we're just going to have to stop testing for it. Because at some point, it becomes pointless. But anyway, I know we haven't quite gotten to that point yet, but this is another person that had a COVID issue.
Hey, Dr. Steve.
Hey,
just listening to your recent episode talking about if recent COVID strains cause, a loss of taste. And I'm just getting over, I don't know if I didn't test myself. I don't know if it was COVID or the flu or whatever, but, I kind of had the flu/COVID symptoms, cough, fever, body aches, etc. And then at the end, everything started tasting very bitter. Or I just had a low-level bitter taste in my mouth, so things like alcohol and coffee would taste really, really bad. And it's been 3 days maybe, and it's starting to get better, but still not quite there. But I didn't quite lose a full sense of taste, but my taste buds were definitely changed.
Yeah. So there's lots of things can cause bitter taste in your mouth, though,
Divorce.
Okay, I gotta give
Give yourself a bill.
One, yes.
The
There you go.
process.
Just at the end of class. Just in the
Man, you are one pathetic loser.
Well, yes.
I don't think
That's
so.
okay.
No, I was directed at me, too.
Yeah, that's what I sort of started to say. It's not just you, Scott.
No.
Lord have mercy.
No. Yeah. So divorce, oral health issues, GI issues can also do it, acid reflux, but supplements and medications. So some things that you might take during COVID, like vitamin D. What do you?
It's hot in here again. It's hot in here again.
Vitamin D, iron, calcium, but people will take vitamin D when they have COVID-19. That can cause a bitter taste or metallic taste in your mouth. And stress and anxiety can cause alterations of the taste in your mouth as well. Anxiety can cause dry mouth. Do you know the medical term for that? Anyone? PA Lydia?
I can't remember right now.
Xerostomia.
Xerostomia, yeah.
But in this case, it was temporarily related to the patient's COVID-19, so we're going to just assume it was that. But that's interesting. So we are, Scott, getting a few people that are calling in saying, yeah, we're still seeing these symptoms out there. You and I haven't seen it, but they're still having
I
it.
wonder. So in chemotherapy, right,
Yes.
when you get taste alterations related to chemotherapy, there's some data for sublingual B12. There's a trick where you do a super, super sour candy.
Yeah.
And it temporarily restores your taste. And we think that the COVID taste disturbance may be related to neurological impact, right? So I wonder if it might be helpful.
Well, that's interesting.
So I don't know.
Worth a try.
Yeah.
When I had Delta variant, I used Flonase the whole time because it just seemed like it made sense. And I never had any changes in I lost 1/16 of my lung to scar tissue, but I didn't lose my sense of taste, and I attributed it to that, or I may not have lost it at all. But there is a little bit of data that says if you start using Flonase or other nasal steroids at the beginning of the syndrome, that you may be able to prevent this. So that's something, but that didn't hurt anything.
Something that's not hurtful, yeah.
Yep. All right.
Namaskar. What's up, fellas? How's life?
It's the same.
Well, mine is just peachy keen. So I went to the doctor yesterday, a doctor, or saw a nurse lady or somebody. I got some doxycycline caps.
Excellent.
100 milligrams, 14 of it, for my drippy dick. Yeah, apparently.
Oh, this is the sequel.
That's a woman that wasn't clean. And this bitch. But anyway, while they were checking me out and stuff, nobody even looked at my dick. So
What?
kind of like,
Oh, that's not cool.
No, that's not good.
No, if you're going to treat STDs, you got to look at it. You got to look at the genitalia. You need to stick the swab up there. That's always fun. Is this little tiny swab, and they stick it up your urethra, and then not only does it need to sit there, but they have to twist it. And it's the twisting that gives you the abject agony. And I can't speak from experience on this one, but I have done this procedure on other people, and this is what they tell me. And then you culture it, and then that way you know if you're treating what you think you're treating.
Right.
To hand people doxycycline, well, anyway, hopefully it gets better. So
not special, I guess. But they checked my blood pressure, and it was like 180 over 80, I want to say, 80 or 60.
yeah, that's high, but it was probably because you were getting STD treatment.
You might have
so
expected.
yeah, you might have expected the swab up the dick because you listened to the show, and as we talked about that multiple times, that's the correct way to do it. So just get your blood pressure checked again.
Yeah.
And if it's back down, you can forget about it. If it remains elevated, get that treated because hypertension is the silent killer.
Yes.
Thank you. All right. Let's do this one.
Hey, Dr. Steve, Dr. Scott, Dr. Casey, how are you guys doing?
Good. How are you?
Doing well, thanks.
Left out PA Lydia.
I had a question about cancers that are caused by exposure to toxins like mesothelioma with asbestos or these rare cancers from people who were involved in ground zero cleanup. Does the cancer or like the cell mutations start at that moment of exposure and it just takes years, before it gets big enough to where it's detectable or causing symptoms, or does it, start some chain of events where it's in some latent phase and it's a ticking time bomb that starts causing cancer years down the road?
Yeah.
I'm just wondering, like these cancers from one-time exposure or like in a short period of time, how it causes cancer years later.
Yeah, that's a good one. So let's talk about asbestos. So asbestos is this mineral that you can pull apart into little fibers. And so they used it for insulation for years. And when you inhale that, which I used to go gem mining in an asbestos mine. So, and by the way, if you've been exposed to asbestos, just don't smoke. That's the big thing. If you smoke and have asbestos, then that's a real problem. But the body can't break these things down, and they get stuck in these tissues, and they start causing inflammation and irritation. And over years, they'll cause inflammation that'll change the DNA of some of the cells around them. And let's just say it's 1 in a million, and you affect 100,000 every year. Well, then in 10 years, one of those cells you would expect would convert to a cell that could reproduce itself. It's unlikely, if you damage DNA, that it's going to be anything functional, right? It'll just kill the cell. But every once in a while, you'll damage the DNA in such a way that it'll start growing like crazy, and it's successful. And when that happens, then that's basically cancer because it's growing. It's not supposed to be growing that way. It's supposed to be regulated, and it's not listening to the signals trying to regulate it. So anyway. So then that's what happened. So it could happen the first time, but it'd be very unlikely. It'd be like hitting the It's like hitting the lottery. So I've heard the lottery described as if you take pennies and you stretch them from New York to L.A., and you take one of those pennies and paint it blue on the other side. And then you drive from New York to L.A., and you stop somewhere along the way, and you pick up one of those pennies, and it's the blue penny. That's the same sort of odds of winning the lottery. So that's the same sort of thing here, is that it's very unlikely. But then once it does happen, once someone wins the lottery, once it happens, then the cancer is inevitable at that point. Mm-hmm. All right. Okie dokie. I do want to talk about this one. I hope.
Hey, Dr. Steve. I'm the one that called you a couple weeks ago about the antibody level with the COVID vaccines and having the rough time with the third booster. Yeah. So my COVID antibodies were a COV2 and IgG2 antibody screen, and it was greater than 25,000 units AU/ml. It stated that anything over 50 units was considered to be high. Yeah. The reason I'm concerned is because I do have an autoimmune. I'm a teacher. I work as a paid EMT, and I am exposed on a regular basis. And also, when I contracted H1N1 and H1N2, I had a pretty serious reaction where I ended up nearly on a ventilator with.
Yeah, I think that there's. What happened to the volume? Sorry. I think that there's an argument you could make that says I've already, I have these huge antibody levels. Don't pose a danger to anybody, and you could probably get out of doing those other vaccines, and you just have your rheumatologist write a letter or your primary care. I think that's fine. I don't see any problem with that. And natural immunity is kind of interesting. There was a study, and I talked about this on Twitter, and we have a little bit of time left. And this is a journal article from the American Journal of Public Health called SARS-CoV-2 Infection, Hospitalization, and Death in Vaccinated and then in Unvaccinated but Infected Individuals. So they were looking at the difference between vaccinated people and people with natural immunity. And what they found was that there was a 37% decrease in all-cause mortality in people who were vaccinated compared to the people with unvaccinated, who were unvaccinated but had natural immunity if they got it again. Now, 37% sounds huge. You know how many? So there were 34,000 kids in here. And you know how many of them died over this period of time? And it was 12 months? 4. And how of the previously infected, the natural immunity but unvaccinated kids? 6 out of 34,000. So that's just for the kids. The adults showed higher numbers, but this is all-cause mortality. This doesn't say that they died from the virus. Okay, it's all-cause mortality. So the absolute risk, even in the adults where the numbers were more like, 60,000 and, people and 250 deaths compared to 400 and something, whatever, the absolute risk was still very, very small. So what the interesting thing in this is both sides, sadly there are sides to this, can say, we're right. If you're pro-mandate, you can say 37% decrease, okay? Or if you are anti-mandate, you can say the absolute risk is 0.0002. Both of those people are correct. Yeah. That's the problem. And that's why it's so hard for us to reach any kind of consensus, because we're all cherry picking the statistic that says the thing that we want it to say. And they're both right. Neither one of those is wrong, which is basically the same way of saying the same thing. It's, yes, they're right, and neither one of them's wrong, so I'm a dang genius. Anyway. All right, Dr. Scott, you had something from the waiting room before we get out of here?
We do. We have a question from Lovett. She's wondering if a white blood cell count of 11.5 is high.
Okay. So would that be chronically high? Or is it just intermittently? I mean, just a one-off. So
assuming it's one-off, because she didn't say it was chronically high.
Okay, so let's talk about both. PA Lydia, this is your realm.
Lots to unpack there.
Yes.
So, if whether chronically or not, yes, Technically, it is. So anything over 10 or 10.0, or in our world, 10,000 is high. So 11.5 would be 11.5 thousand.
Mm-hmm.
So it's technically elevated. So the next thing to
What
look
is that,
at.
11.5 thousand per high-powered field, or is that cells per deciliter? Or
I
what
thought it
is
was
the
cells per
units of that?
deciliter.
Okay.
Take a peek.
I'll look at it.
And so that would be your total white blood cell count. So then, the next thing we look at is that chronic or is it acute? And
Per
then
microliter.
what type of cells are elevated? So are they your neutrophils? If your neutrophils are more predominant, you would think about more like bacterial infection, more lymphocyte predominant when you look at the differential or the breakdown on your lab sheet.
Okay.
You might think more about viruses, maybe chronic inflammation.
Mm-hmm.
Eosinophils being elevated. You might think more about allergies.
What are all these different cells?
Yeah.
So you said neutrophils, lymphocytes, and
just
eosinophils.
types of white blood cells, right, that make up your immune cells, and they are targeted and powered to impact different things, whether it be bacteria, viruses.
And they look different under the microscope. That's why they called them that, because the eosinophils took on more eosin, which is a red pigment. And, they wash these things with red and blue pigments, and then you look at them under the microscope. Some of them will not hang on to the blue, but keep only the red. Mm-hmm. And the neutrophils, I guess, did a little bit of both, because they are kind of purpley looking.
Mm-hmm. Yeah.
And then the lymphocytes have bigger nuclei compared to the cytoplasm, compared to, say, a neutrophil.
Yeah.
So
when you're thinking about it, if it's a chronic thing, which we get referrals quite often of chronic.
Well, you guys get referrals for people who have, a slight anemias and stuff.
Yeah. So, probably the second most common to anemia would be the elevated white blood cell count.
Yes.
So the first thing we do is we look at what type of white blood cells are elevated. And then, you can do something called a flow cytometry if it's something that's very chronic, meaning it's lasting for a long time, just to make sure none of them are cancerous. However, one of the most common reasons is something that induces chronic inflammation in the body. So something like cigarette smoking or chronic stress or chronic illness.
Really?
So those are the most common causes of a chronic mild elevation in your white blood cell count.
Okay. So now what do you do? So you're at your primary care physician's office. They say, well, you've got a white cell count that's high. I'm going to send you to the hematologist. What should you be worried about it? What's the deal?
No, the vast majority of the patients we would take a peek. We would make sure that there's no sign of malignancy or concern for malignancy, and then kind of the chronic inflammation, stress, or exposure to tobacco smoke would be a diagnosis of exclusion. And you just monitor it every few months, make sure nothing changes.
Yeah. What about these people that have monoclonal gammopathy of uncertain significance?
Mm-hmm. So that would be something that we...
What is that? I mean, I know what it is. Tell them.
Yeah. So one type of your white blood cells, or closer to a stem cell, is called a plasma cell.
Mm-hmm.
And a plasma cell exists in your marrow. It starts to mature. It should be exposed to an antigen or something like a virus, and then go back and just, its job should be to make antibodies to a certain virus or to a certain antigen.
And they remember it.
And those antibodies are proteins, and they come, those antibodies are immune globulins, have light chains and heavy chains. And so sometimes a plasma cell line can get mutated, or a plasma cell can get mutated, make more of itself, and make an abnormal protein.
Yeah.
And so when you look at someone's protein under mass spectroscopy, where you actually go and you kind of sort out all of the proteins in the person's blood or in the person's plasma, if you see a spike of a certain protein that is a nonsense, but that is a clone, so they're all the same, but they're not really encoding for anything, that is monoclonal gammopathy. And as long as that patient doesn't have other signs of malignancy, like trouble with bone lesions, kidney disease, low blood counts, it's undetermined significance.
Mm-hmm.
So it's like something that has the potential to turn into malignancy. It's not malignancy, and we monitor it.
What are the odds that that'll turn into a malignancy?
It's 1 out of 10 per year. So you've got like a 10% risk per year.
Okay.
So if you have, and I'm going to stop myself, but the longer you have MGUS, the more likely you are to develop into a cancer.
But at every year, it's still 10%. So if you have a 10-sided die, you could roll. If you had a die that had 10 sides and there was 1 blue side and 9 red sides, you could roll red sides for the rest of your life. It's not impossible.
Correct. Yeah. But the risk does go up the longer you
Okay.
are living with it.
Very
Just
interesting.
monitor.
All right. Well, thank you. You got anything else out there, Scott? They're probably sorry they asked now.
No. That's no. Lovett said thank you. She said her neutrophils were 78/84.
Yeah, so that's a little bit higher of a percentage. So maybe she's overcoming some recent bacterial infection. It could also be a stress.
Well, yeah, one thing is when you see an abnormal lab test and it's just out of the blue, the first thing you do is repeat it.
Yes.
Because there's this thing called regression to the mean, where you will often, if you have an aberrant lab test, then you do it again, it's normal. If you do 20 lab tests and they have a 5% margin of error, that means it's very likely one of them will be abnormal, just because of lab error. Right? And it's not that they made a mistake. There is a margin for error in all of our tests. None of them are so precise that there's no error. As a matter of fact, you could not make a test that had that. It's not physically possible in this universe to make one that there will always be some error no matter how precise you make your measurement. So
Yeah, I get tested again. So if she had a white count of 11.2 and it was 80% neutrophils, that's an ANC of 9.2, which is significantly.
Absolute neutrophil count.
Yeah.
Jargon alert.
Yeah, sorry guys. So,
okay.
I mean, that's something to make sure you don't have any signs or symptoms of bacterial infection, a sneaky urinary tract infection that could be going on, and have it rechecked.
Well, you women are always getting your cystitis, don't you?
Yeah.
with your monthlies.
Pee after sex.
There you go. Very good. Yes. You're not kidding. That's a serious answer.
It is.
All right. Very good. Well, listen. Thanks. Always go to Dr. Scott. Thanks, Tacey. Thanks, PA Lydia. Thanks to everyone.
Thank
Made
you.
this show happen over the years. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Happy New Year.
Happy New Year.
Happy New Year.